Here we have video 2 for chapter 4, the circulatory system. Here we are starting on slide 15. Here we're looking at a picture of the heart that's showing the conduction system. This figure shows the cardiac conduction system of highly specialized tissue that convey electrical impulses and coordinate the contractions of the heart. The atria contract simultaneously, followed by simultaneous contraction of both ventricles. Electrical impulses begin in the sinoatrial node, or the SA node. This is the natural pacemaker of the heart. The impulse from the sinoatrial node, or the SA node, then travels through the atria to the atrioventricular node, the AV node. The AV node which then conducts the impulses to the atrioventricular bundle, which is also called the bundle of His, and then to the Purkinje fibers and the walls of the ventricles. So it's almost like the domino effect. It starts here, pushes through the atria to here, to the atrioventricular node, which then makes its way down these two atrioventricular bundles, okay, and then to the Purkinje fibers. Okay, allowing for contraction of the top half of the heart and then the bottom of the heart. Here we are looking at the anterior view, so the front side view of the aorta. The aorta, which arises from the left ventricle, is the main trunk of the systemic arterial system. The aorta branches into the many arteries pictured on this slide, which deliver oxygen and nutrients to specific organs and tissues. The aorta is divided into three portions based on location. You have the ascending aorta, the aortic arch, and the descending aorta, which is further divided into the thoracic aorta and the abdominal aorta, which you can see in this image. This chart shows the schematic diagram of the aorta and its many branches. Okay, so if you remember the aorta, that aortic means pertaining to the aorta. Okay, we have the term intra-aortic, which is one of your pronunciation terms. This means within the aorta. You're not required to learn all of these branches of the aorta, but it is good to note what areas of the aorta supply what areas of the body. So, for instance, branches of the ascending aorta supply blood to the heart muscle. Branches of the arch of the aorta supply the upper extremities, so the arm, neck, spinal cord, and brain. Branches of the thoracic aorta supply the chest. Branches of the abdominal aorta then supply the pelvis, lower abdomen, and lower extremities, as well as many of the internal organ. If you remember, those we call viscera. Here we're looking at heart rate. Okay, heart rate is the number of beats per minute of the heart. Okay, so we abbreviate that BPM, beats per minute. When we talk about heart rate, we often call it pulse. Okay, pulse is the rhythmic expansion of an artery lying near the surface that can be felt with the fingers. So our normal resting pulse for an adult is 60 to 100 beats per minute. Okay, some of the areas that are easy to find your pulse: your carotid artery in your neck, your radial artery in your wrist. Okay, and when we are counting pulse, we often count for 30 seconds and then multiply that number by 2 to get our beats per minute for our pulse. Some terms that go along with our pulse or our heart rate. We have bradycardia. This is a term that means slow heart. And we define bradycardia as less than 60 beats per minute for somebody's heart rate. And then we have the term tachycardia, okay, which that term means fast heart. And we define tachycardia as more than 100 beats per minute for a heart rate. Another topic we look at with the cardiovascular system and our blood is blood pressure. So blood pressure is shown here in the images A, B, and C. Okay, these are three instruments that will take a blood pressure measurement. So A is showing you a mercury sphygmomanometer. B is showing you an aneroid sphygmomanometer. And then C is showing you a wrist automatic digital device. So blood pressure is abbreviated BP, and it is measured in millimeters of mercury. Okay, the units we use for blood pressure are mmHg. And the blood pressure is how much force rises the mercury in the sphygmomanometer. So with our blood pressure reading, we have a systolic pressure. This is the pressure when the ventricles contract during systole. And then we have a diastolic pressure, which is the pressure when the ventricles relax during diastole. A sphygmomanometer is the name of the tool that measures blood pressure, or the blood pressure cuff. Okay, this is what measures the pressure. And a term that we associate with blood pressure is high blood pressure, which we call hypertension. And the abbreviation for hypertension is HTN. So if we look at our blood pressure measurement, this picture shows the 3 steps in measurement of blood pressure with a sphygmomanometer. So picture A shows blood flow to the brachial artery is cut off. That's when we pump up the cuff. B shows when the pressure is released to below the systolic pressure but higher than the diastolic pressure. And when the first sounds of the heart rate or the heart beating are heard at this point, that is our top number of our blood pressure reading, our systolic pressure. And then more pressure is released, like we're seeing in picture C, until the pressure in the cuff is below the diastolic pressure. Then the sounds disappear while blood flows freely. When we no longer hear the sound of the heart beating in the stethoscope, that is our bottom number of our blood pressure reading, our diastolic pressure. So if we're looking at blood flow during systole and diastole is what we're seeing here. A is showing you blood flow during systole. This is when the ventricles are contracting. And then image B here is showing you blood flow during diastole. This is when the ventricles are relaxed and the atria are contracting. Here we see some lab tests that we associate with the cardiovascular system. So lipids are fats. Okay? Lipids are fats that can be measured in our blood. So our lipids include cholesterol, which is a component of animal cell walls, and triglycerides. High levels of these two lipids are associated with greater hardening of the arteries, which we call arteriosclerosis. Lipoproteins are specialized proteins that transport lipids in the blood. Increased LDLs is associated with an increased risk of cardiovascular disease. Okay, our LDLs are our bad cholesterol. HDLs are high-density lipoproteins. Okay, increased HDLs is associated with a decreased risk of cardiovascular disease. So our HDLs is our good cholesterol. This number we want to see high. A damaged heart muscle will release certain enzymes into the bloodstream. So those enzymes are lactate dehydrogenase and creatinine kinase, or CK. And levels of these enzymes usually rise within a few hours after the damage is done to the heart muscle. So when somebody believes that they've had a heart attack, these are tests that are done to determine if the heart muscle is damaged. So if somebody believes they have a heart attack, they may have this enzyme test done. And if these enzymes are present, that can indicate that there was damage done to the heart muscle and a heart attack is likely. Here we're looking at a few more diagnostic tests. The first chunk of terms up there uses our trio of suffixes, graphy, graph, and gram. So these should be easy. We talked about them in chapter 2 already. Electrocardiography would be the process of recording the electrical impulses of the heart. The electrocardiograph would be the instrument used to record the electrical impulses of the heart. And then electrocardiogram would be the record produced from the electrical impulses of the heart. Okay, and electrocardiogram is also known as an EKG or an ECG. A Holter monitor is a portable electrocardiograph that a person can wear while conducting normal daily activities. So if somebody is given a Holter monitor, they're going to wear it throughout the day while they go to school and they participate in gym and they do their daily activities to determine how their heart rate is affected. Their heart impulses are affected by your daily activities. A chest x-ray can be ordered as a diagnostic tool, and this is going to give information about the size and position of the heart. And then we also have stress tests. Okay, stress tests measure the heart's response during controlled physiologic stress, and this is usually exercise. So in the treadmill exercise test, an EKG or an ECG and other measurements are taken while the patient walks on an inclined treadmill at varying speeds and varying inclines. The thallium stress test and other nuclear medicine procedures also measure cardiovascular function. This is especially used when coronary artery disease is thought, and this is going to image the heart during while the heart is under stress. Here we are looking at what an electrocardiogram would look like. Okay, so you don't have to memorize the parts of this wave graph that this figure shows. This figure shows the waveform corresponds to different points in the heart cycle of pumping. So the P wave represents the atria contracting, so atrial contraction. The QRS complex represents the ventricles contracting. And then relaxation of the heart occurs at the T wave, and then the cycle repeats. Okay, so P wave, top half of the heart is contracting, QRS, the bottom half of the heart is contracting, and then T is at rest. And then we start back over again.